Kelly, thank you so much for hopping on a Zoom call with me. I was looking at when you were in town doing your show again, and I am absolutely excited for a second helping. So tell me where you're at. I know you just did a show, and for people who don't know you, I met you at the Sansiel conference in June, which was awesome. And I think your background is so incredible because you are a nurse and that's extraordinary. You have been a nun and you now are a comedian, which it almost feels like, it's brilliant.
Well, it's funny. Sometimes I'm really glad that's your reaction because some people are like, well, how do you go from being a nurse to being like or a nun to being a nurse comedian? And I'm like, it's not even a right hand turn. It's like, to me, it seems like, oh, this is like when you're young, you're a nun, and then you end up being a nurse comedian. Like, it does not seem like a right turn at all. It just
You're
seems
like, it
like
was a path.
inevitable, Yeah.
Well, I loved the work. It was one of the most joyous things at Sansia. I absolutely love the work that you do. And, I think as nurses, we do have, the kind of, the tragedy is part of our profession. And it's something that I don't think in my early profession, we really had the ability to talk about it. When I look at your work, your writing, the work you do in the workshops, I mean, you're brilliant at taking tragedy and somehow putting this light or this ability to, I don't know, it's almost like the humor and the way that you make us laugh allows me to process it and yet still find some kind of joy. But I want to hear your perspective on that because it was really extraordinary and I'm excited for your next show. But I mean, is this the nun nurse comedian thing or that was a very direct path? Or how do
Right. Well, I
you
used to, when I first started doing comedy, I started doing comedy when I was in nursing school, actually. I used to go to the open mic. I can remember going to the open mic after clinical. Now I think like I was really somebody in my 20s because I would not do that now. But uh and I always wanted to be a comedian when I was a kid, since I knew it was a job. It was like a mile walk home from where the bus dropped us to my house, and there were beef cows on one side and dairy cows on the other, and I would alternately tell them jokes, um,
the
and I would
cows?
say, yeah, and I would always say like that wasn't even my worst crowd by far. So I always wanted to be a comedian, but the way you get to be a comedian is you have to do it in front of people badly. And so that it takes a little bit more self-esteem. So it was actually nursing school that I was like, well, if I'm not killing people in clinical, surely I can get up and make people laugh and it won't kill me if they don't laugh. So that's kind of when I started it. And when I started it, I was kind of doing, you know, much more, not quite take my wife please stuff, but definitely lighter stuff, about and people thinking I'm, a 12-year-old boy, which
Which is
was
one of
great.
your
It was
pieces,
great.
right? Like,
Yeah.
yeah.
Yeah. I had an album called CD called I'm Not a 12-Year-Old Boy. Just recently I've really gotten like eye wrinkles and now people almost always think I'm an adult. But um like I was at the barber shop. I mean, it wasn't even a year ago, and I had the cape on already, and it was on a Sunday morning when all the little kids go. So maybe that was my own problem. But the little kid was crying, getting his haircut, and his dad pointed to me and he said, "That little boy's not crying." And I was like,
Like,
when do you stop crying at haircuts? Like at least by 7. So he got my age wrong by 47 years. Like that's
well, at least he
that's a
thought
long
you
time.
were young.
Yeah, yeah, exactly. So so that was more of it. And then I lost a partner to cancer. And then 5 years later, I lost another partner to cancer. And so my comedy ended up kind of taking a more, I don't know, serious turn.
Yeah.
You write what you're familiar with. And so that was, and in the beginning I wrote kind of, now I realize it was just too grim. People weren't going to be able to laugh at it. But now that I've metabolized more of that, people are more able to laugh at it. And also I want to, these are real things. These are real things that people go through. I'm not the only one. And often it's hard to describe grief to people. I once had a therapist who said that grief is a language, and you either speak it or you don't. And so it's very hard for people who are like newly grieved, like new widows, for example, to explain their grief to other people. And
Right.
so in getting up and like doing this show about losing two partners, it enables people, first of all, to understand it better because there's also laughs in it, so they can breathe through it a little bit better. But also it makes grief approachable to people who might not have, might not have lost somebody close to them yet, because we all will lose somebody close to us. That's part of being alive. So.
Right. Right. That's what there's one of the nurse disrupted team members says there's only two things, and it's that, everything's gonna change and then you're gonna die, which is a terrible way a terrible way to put it, but you help us face this so fearlessly. Like I look and I think that at least I've been ingrained to stuff it and to be tough and pull up your bootstraps, and that you bring us through your grief and these things. I think it's so special and such a cool thing. And I see you go to nursing schools. Do you go to hospitals as well, or when there's nurses are looking at like some kind of fusion of joy? Is it workshop like NCL that you would do in hospitals, or have you done that? Because I think of just the kind of state of mind of bedside nurses, especially in general right now. And
Yeah, the groups that have brought me in, very rarely. Well, for example, I did do that for it was for Nurses Week for a children's hospital in Florida. That was something specific for hospital staff, frontline staff, like a virtual thing where I talked about, figuring out ways to inject humor intentionally into your day. So that is one example. And then like nurses unions often bring me conferences, has been good for me. Sometimes hospital systems, and I'm also kind of a twofer too, because sometimes the employee resource group, the LGBT employee resource group, will bring me in, and I have a presentation called Laughter at the End of Life, which is specifically about, you know, patients and families use humor all the time when things are very, very serious, but I don't remember in nursing school anyone teaching us how to respond to that. And there actually is a lot of good research. And one of the biggest things is when uh, healthcare providers do not respond to patients' attempts at humor, at least to acknowledge them, it makes patients less adherent to the treatment guidelines. And with kids, it makes them not trust the providers, which makes sense,
yeah,
right? If a kid makes a joke to somebody and just like, they think like, oh, what's wrong with you?
yeah, yeah. Humor is so important, and I think too there there's this culture of nursing where somehow there's supposed to be maybe a piety to it. I mean, similar, I think being in how people see nurses too, where it's like we're not supposed to, I mean, although we have an incredible dark sense of humor, but it's not supposed to be humor. It's supposed to have a serious job, and we're there and we're serving, and we're the heart of healthcare. And it's like, we talk about this a lot here. Nurses are allowed to feel joy, to be joyous, and to seek that out in their career and in their life. This is not a life of servitude. This is an ambitious science and career that we're thriving for. And so I'm grateful for the joy that you put into it, because we definitely, boy, it's
Yeah.
it's a life. I mean, life in general, but it's a career. And so any advice?
Yeah, that it's not a punishment. That it's not a punishment. That's a really good point, right? Like, and nurses do have a sense of humor. And one of the things has been like, okay, what kind of dark humor is okay? And and the biggest thing, the research is like, what kind of dark humor does not contribute to demoralization? Is it just if you're punching up, right? If you're making fun of people who have more control in the situation, right? Like, so making not fun of a patient, but rather the system, or that kind of thing. But yeah, like humor really helps. It really, really helps. Like the research is all that it does.
Yeah. We were thinking, I was at A1L earlier this year, and there was a lot of chatter with executives about um we sound so like middle-aged, silk scarves and her and stuff. But I was thinking about this a lot, where they're like, there's so many nurses on TikTok, and there's like this negative tone, which I think, I've got a 13-year-old daughter. It's like texting and social media and all of that can go to that dark place. But, can we take things to that empowering place? Like, can we, the technology is here, the social media is here and whatnot. And I think, I think in my role now, like how Well, just aside from having you come and speak and do that more empowering message and, teaching people how to have joyous humor that, that can be enjoyed by a lot of people instead of some people feeling like, just got, demoralized or, don't talk about my ick, when
Right.
experience
Yeah,
change, so.
exactly. And there is so much, there's so many possibilities and yeah, and I do think that there's something to be said for like doing making the intentional room for humor, for intentional humor so that we don't slip into humor that can be demoralizing, right? Like if you have, I don't know, cartoons outside your office or whatever, or, things that are going to naturally make people laugh, then, it kind of keeps the spirit a little bit up so it's not quite going to such a dark place.
Right. I think a lot of the people, that we're talking to, I mean, Nurse Disrupted is a technology company and virtual nursing company, but it is trying to find that joy, that why, the ability to embrace our profession, be excited about it. And I think that's where you and I are really aligned, like, the profession, the joy of it. I mean, again, we'll put your site up here. I think you're brilliant. I think people bringing you in, you had a huge impact on me at Sun CL. So with that, I'm excited for August. Anything you want to leave our phone call with?
Yeah, I'm super excited too. I am very, if you are afraid of bringing a comedian because you think comedians are poorly behaved, I'm not a poorly behaved comedian. I'm a well-behaved comedian. And, and also people should like, when people are worried about booking me, I do have I have full shows that I can show them so that they can understand. Because it's a little bit hard to understand exactly like a comedian nurse. I don't know. You know what I mean? People are so yeah. So I'm a well-behaved comedian. Yeah, and I do want to bring joy. That is, I feel like, this part of my career is I'm helping the helpers. I want to support people who are helping.
Yeah, that's huge. Well, we definitely felt it. And I do. I think first thing in the morning on a professional conference, like to get people rolling on that. I mean, you're fantastic. And I really love what you do. So thank you so much. Thanks for hopping on and talking
Oh
a
yeah,
little bit.
absolutely.
And yeah, I'll catch up with you soon.
All right, thanks, Leopard. All right, take care.